Okay, in this video, we are going to look at muscles of the arm and the forearm. So when we look at the arm, the major muscle that we see here is the biceps brachii. There is a short head and a long head. On the opposite side is the triceps. So the biceps and triceps are completely antagonistic. Both of them cross the shoulder and the elbow, which means they can work on the shoulder and work on the elbow. It flexes the shoulder and flexes the elbow. The triceps are antagonistic to that, which means it extends the shoulder, extends the elbow. Completely antagonistic. The brachialis is also an elbow flexor. It is a very powerful muscle of the arms anterior. When we look at the anterior forearm and the posterior forearm, one of the things I would like for you to understand is that the muscles that are on the anterior forearm cross the wrist, which means they're going to flex the wrist. Okay? So if a muscle is on the anterior of the forearm and crosses the wrist, it's going to flex the wrist. If they cross the fingers on the anterior side, they flex the fingers. So let me give you a second to think about what would be true for the muscles on the posterior. Think about that. So what they will do is that the posterior muscles of the forearm that cross the wrist on the posterior and cross the fingers on the posterior will do the exact opposite of what these did. So here on the posterior side, they're going to extend the wrist and extend the fingers. On the anterior side, they flex the wrist and flex the fingers. Okay, so just keep that concept in mind. Also, most of the wrist flexors and finger flexors are going to originate off the medial epicondyle, whereas most of the wrist extensors are going to originate off the lateral epicondyle. Just keep that in mind. Okay, so now on the forearms anterior, here's the cubital fossa. There's the Pronator Teres and Brachioradialis. Those are superficial. Here's the Pronator Teres and the Brachioradialis. The Pronator Teres will pronate the forearm, whereas the Brachioradialis, it goes from the humerus to the radial styloid. That's an elbow flexor, believe it or not. It flexes the elbow in the neutral position, okay, like this. Not supinated, not pronated, but in the neutral. It's the politician muscle. Okay, then we have along the forearm, we have four muscles, and I like to describe them like this. So if you take these four fingers and you put your thenar pad over your medial epicondyle, and you put your four fingers like this, okay, I'm trying to make sure you can see that. The thumb is the Pronator Teres. The thumb is the Pronator Teres. The pointer is the Flexor Carpi Radialis. The middle is the Palmaris Longus. And then the ring finger would be the Flexor Carpi Ulnaris. So put the thenar pad over the medial epicondyle. Put your three fingers down the forearm. Your thumb would go down this direction. This is the Pronator Teres, Flexor Carpi Radialis, Palmaris Longus, and Flexor Carpi Ulnaris. Okay? On the extensor side, on the posterior side, everything with extension. If you look at the names, Extensor Carpi Radialis Longus, Extensor Carpi Radialis Brevis. When you see the word carpi in it, you know it means carpals. Longus, it's a long tendon. Brevis, it's a short tendon. If you look at abductor pollicus, extensor pollicus, pollicus refers to the thumb. So if it's an abductor pollicus longus, it's going to abduct the thumb. If it's an extensor pollicus brevis or an extensor pollicus longus, they'll extend the thumb. All right, so general rule of thumb, flexors in the front, extensors in the back. That's the take-home message. So now here we're looking at the shoulder in the front. Here's the coracoid process. There's a muscle that looks like it's originating here and going down. This is the coracobrachialis. So what is the origin of it? Coracoid process of the scapula. Now we're looking at the anterior arm. It looks like the biceps, but it's pointing to and highlighting this portion of it. This is the short head that originates on the coracoid process, along with pec minor and the coracobrachialis. So this happens to be the long head of the biceps brachii. Now it's asking for the action. Well, the primary action of the bicep is to flex the forearm, flexion of the forearm or flexion of the elbow, same thing. It can also flex the shoulder, but that's not a choice. And it can also supinate the forearm, but that's not a choice, okay? Now, here's the rhomboid minor, rhomboid major, spine of the scapula, supraspinatus, infraspinatus, teres minor, teres major. What pierces between teres minor and major? The long head of the triceps. But what is it asking? It just wants to know triceps in general because the entire muscle is highlighted. What is the action of the triceps? Well, it's a posterior muscle. It can extend the shoulder and extend the forearm. Best choice, extension of the forearm or extension of the elbow. Now, here's the long head. Here is the lateral head. So the lateral head of the triceps. Here's the long head of the triceps. Again, pierces between teres minor, teres major. Okay, now here is the medial head of the triceps, and it wants to know what is its origin. Shaft of the humerus, pretty general, straightforward. If it asks for insertion, the insertion's on the olecranon process of the ulna, which is the back of the elbow. Okay, now we're looking at the front, right? Here's the abdominal muscles, here's the clavicle. So what short muscle do we have here that crosses the elbow as primarily a belly of a muscle? It's not the subscapularis, that's here. It's not the triceps, that's the posterior. It's not the deltoid, that's the shoulder. It's not the biceps brachii, that would be the entire arm. This is the brachialis. It's a powerful elbow flexor from the pronated position. Now it's asking for the origin. Well, the origin's just here. It's the shaft of the humerus. What is the insertion? The insertion of the brachialis is going to be on the ulna, on the proximal ulna. Okay, a little bit on that coronoid process to be exact. So it's going to be the coronoid process, which is on the proximal ulna. Okay, now we're looking at the forearm. We see the palm. Here's the thumb. So there's a long muscle on the lateral side of the forearm. It goes from the just above the lateral epicondyle and goes down to the styloid process of the radius. So it goes from the brachium to the radialis. So it's the brachioradialis. Brachium, because it's the lateral epicondyle. Just above it, they call it the lateral supracondylar ridge, to the radial styloid, so it's the brachioradialis. Okay. If it wanted to know flexor carpi radialis, that's this one. Flexor carpi radialis. If it wanted coracobrachialis, that's way up high. What is the origin? Shaft of the humerus. It's the only thing that it could possibly be here. Greater tubercle is too high, olecranon is posterior, lesser tubercle is too high, head of the radius, it's just wrong. So it's the shaft of the humerus, more specifically the lateral epicondyle and the supracondylar ridge. Okay, on the forearms anterior, this is easy enough. It's drag and drop. So if we were to look at the three main wrist flexors, it's the flexor carpi radialis, which is more on the radial side, the thumb side. Then there's the flexor carpi ulnaris, which is more on the pinky side. And then right down the center of the palm is the palmaris longus. Okay, so just look at the tendons. This is more radial. This is more down the center of the palm. This is more on the ulnar side. So flexor carpi crosses the carpals. Radialis, it flexes the wrist on the radial side. Flexor carpi ulnaris flexes the wrist, it's on the ulnar side. Palmaris longus goes right down the center of the palm. What is this structure? This is the Pronator Teres. It pronates the forearm. The opposite of that is the supinator muscle, right? It's asking what is the action of the supinator? Well, it supinates the forearm. Supinate is when you hold a soup. Pronate is when you're prone to spilling it. What is the insertion? So the insertion, this is wrapping from the posterior side to the anterior side of the radius. So it's got to be the shaft of the radius. That is the insertion. It's not the head of the radius. That's really much more proximal. Okay, so this is the supinator. This is the pronator. And there are two pronator muscles. One is more proximal and one is more distal at the wrist. So that's called pronator quadratus because there are four sides, quad, to this pronator. But they both pronate the wrist or the forearm. Pronator teres, pronator quadratus. Okay, what is the highlighted structure? Well, it's the anterior, so we know it's a flexor. So what can we rule out? It's going to be a flexor of the wrist because it does start at the elbow, come down to the carpals, and it's on the radial side because it's on the thumb side, so flexor carpi radialis. Now this one here, we see that it crosses over the palm, but this one's going to the digits. Okay, so this one is going to be and it's a superficial muscle. It happens to be the largest muscle on the forearms anterior is the flexor digitorum superficialis. The flexor digitorum profundus is deeper to this. So when you see a large muscle on the forearms anterior and you see the tendons going to digits 2, 3, 4, and 5, it's the flexor digitorum superficialis. Now here, we're looking at the back of the hand. This is the dorsal surface. So remember, anything on the back side is extension. So do we see any choices here in terms of action for extension? Yep, extension of digits 2 to 5. 2, 3, 4, 5. This muscle is the extensor digitorum muscle. It extends digits 2 to 5. The thumb has its own extensors, and in many cases, the pinky. The thumb is Pollicus, the pinky is digiti minimi. Now on the posterior side, this one's going to the extension of the wrist. There are two of them. There's an extensor carpi radialis brevis and an extensor carpi radialis longus. Extensor carpi radialis brevis is going to insert somewhere close to the base of the third metacarpal, whereas longus is going to insert somewhere to the second metacarpal. So this one here is longus, so we can see the purple coming right down and attaching to the base of the second digit. So that's extensor carpi radialis longus. And again, if we go back here, this one's extensor carpi radialis brevis to the base of the third metacarpal. Now, remember I said the pinky has its own. So this is an extensor. We could see the purple going along to the pinky. The pinky is a digiti minimi, so it's an extensor digiti minimi. Anything on the posterior forearm, it's going to extend the wrist or extend the fingers. Anything on the anterior forearm flexes the wrist or flexes the fingers. Okay, this is going to be an extensor. It's on the ulnar side. Doesn't look like it's going to the fingers. So we can cross out the thumb. We can cross out the radialis because that's on the thumb side. We can cross out extensor digitorum because that would be digits 2 to 5. Now we have to choose between extensor, carpi, radialis, longus. We know that's on the radial side. We can cross out extensor carpi radialis and extensor carpi radialis. This is on the ulnar side, posterior. So it's an extensor carpi, ulnaris. Best choice. Okay, this one is going to the thumb. It is the flexor pollicus longus. So we can cross out flexor digitorum profundus. That goes to digits 2, 3, 4, 5. Lumbricals we can cross out. We can cross out flexor digiti minimi brevis. That's a pinky muscle. We can cross out flexor digitorum superficialis. Now we got to choose between flexor pollicus longus or flexor pollicus brevis. Well, flexor pollicus brevis, flexion of finger 5. Finger 5 is the pinky. That doesn't make sense. But flexor pollicus longus, flexion of the distal phalange, finger 1. Right? So even if you don't know, just read them, and through process of elimination, you can still figure it out. This again is the posterior side, extensor carpi. It's on the pinky side, ulnaris. And then I've seen this pop, excuse me, I've seen this pop up where here we're looking at a picture of the scapula, here's a humerus, and then here's the ulna and radius. And what you have to do is drag and drop muscles that either originate or insert there. So basically, if the muscle has an attachment site, drag and drop. So the triceps has an attachment site to the scapula because it originates on the infraglenoid tubercle. The Biceps Brachii, the short head originates on the coracoid process. The long head originates on the supraglenoid tubercle. The deltoid originates on the acromion process. The trapezius has lots of origin, lots of insertion, I should say, on the scapula, along the acromion and the spine and the superior angle. The pectoralis minor attaches to the coracoid process. Brachialis, triceps, delts, brachioradialis, and pec major all have attachment somewhere on the humerus. Brachialis, triceps, biceps, brachii, and brachioradialis all have insertion somewhere along the radius and ulnar. Brachialis is ulnar, triceps is ulnar, biceps and brachioradialis are both the radial bone. When we look at, again, place the following muscles in the appropriate category based on location. So the brachialis and coracobrachialis are associated with the arm. The flexor pollicus longus and extensor carpi ulnaris are associated with the forearm. Now, we haven't done these just yet, but the adductor magnus and sartorius are part of the femur, which is the thigh. And then the soleus and flexor hallucis longus would be part of the leg.